Today we're going to discuss the roles of nurse practitioners in healthcare. What is the role of your profession on the healthcare team?
So I'm a nurse practitioner, which means I have additional training to diagnose and treat acute illnesses. I also help work with patients who have chronic illnesses and manage those, help them to achieve and maintain their best possible quality of health. And I specialize in working with older adults and in palliative care. So I work with patients with a serious illness to help them achieve and maintain the best possible quality of life.
I am a nurse practitioner working in family practice. I work in primary care. I am a primary care provider. I work in a great practice where I work with a multidisciplinary team. We have an MD, a DO, and a PA. And then there's me, a nurse practitioner. And I've been working in my practice for over 20 years, and I've been following many of my patients for that amount of time. I've been managing their chronic illness throughout their life, so I have a very trusting relationship. And I believe healing happens in that relationship of trust that I have with my patients.
What does practicing to the full scope of your education and training look like?
I think it means practicing without restrictions. I understand what I'm able to do based on my education and my experience. That sometimes there's limitations placed on what I'm able to do by where I practice, by people that I practice around, and sometimes by state law and statute.
In my practice, practicing to the full scope of my licensure really means that I can spend a lot more time with my patients managing their issues and their illness. I can prescribe medications, I can provide counseling. If I could not, I think that would really limit and fragment my time that I have with the patients. Therefore, we can develop a mutual relationship, and that mutual relationship of respect is helpful, and it is, again, where healing takes place.
What are the barriers to practicing at the full scope of your education and training?
Yeah, so as I mentioned, there are definitely some barriers out there. For example, nurse practitioners in the past have been limited. They can't prescribe durable medical equipment. Some of that's been changed recently, but an example of that is if I had a patient that needed oxygen or a piece of equipment to manage at home, there were Medicare restrictions around what I could do for that patient. And it means another provider had to come in and actually order those. So that's a real practical example of how those limitations affect real patients.
In many ways, the limitations are, I don't feel them personally for myself. I do have to pay somebody, a collaborating physician, to work with me, who really just is available for me to answer questions, and I would actually have that collaborating physician anyway. I really believe in working with a collaborative team, but there are limitations in that I have to jump through a certain number of hoops. I guess people are trying to make sure that I'm collaborating with a physician.
What are some advantages to practicing at the full scope of your education and training?
So it really improves access for patients who need care. Nurse practitioners have traditionally practiced in rural areas where there may not be physicians and other members of the team. So it's really important. I practice in palliative care. There's very few palliative care providers, and if it weren't for nurse practitioners and other advanced practice nurses, there would be many patients that would not have access to the skills and the ability to manage really tough pain and other symptoms.
The advantage is I can spend more time with the patient without having to run out the room, getting approval for this, getting approval for that, or fragmenting my relationship with the patient by demanding that the fact that another professional has to come in and be caring for the patient as well. There is a lot of responsibility to this. To have a full scope of practice you're really carrying a patient's life in your hands. And it's a lot of responsibility. You have to take it very seriously, and therefore collaboration continues to be very important.